This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. Justin Gomez here, joining you again for another episode that is going to tie into how our life is going and how we're managing life during this COVID-19 pandemic that has disrupted the vast majority of our lives on some level. And we have a great guest with us today. Dr. John Petty is going to be joining us in a minute from actually Brenner Children's. Before he joins us, I do just want to let people know, like I've been doing in the previous COVID-related podcast, Wake Forest Baptist Health has a good amount of resources available on our website, and we invite people to go to wakehealth.edu/coronavirus, wakehealth.edu/coronavirus, and people can, there's all kinds of resources, Q&As, FAQs, CDC recommendations, clinic updates, visitor restriction updates, all kinds of information, including these hopefully helpful podcasts that people can use as resources on a variety of topics. So people can also call 336-70-COVID if they have questions related to coronavirus and COVID-19. So Dr. John Petty is joining us today from Brenner Children's. He's actually in the pediatric emergency department at Brenner Children's. So welcome, Dr. Petty. How are you doing?
I'm doing great. How are you?
I'm doing well, sir. Thank you. And I thank you for taking the time to join us today. I know your schedule has been rather busy and a little bit out of the ordinary, like so many other people. So appreciate you joining us for this podcast episode. And, I really want to dive in and talk about, children's safety and what we've seen come through Brenner Children's is an uptick in some injuries and just with the kids being at home more. But before we do that, I do want you to just tell the listeners a little bit about yourself and maybe why you became a pediatric physician and how long you've been with Wake Forest Baptist.
Yeah, happy to do it. So my name is John Petty. I'm a pediatric surgeon here. There are 5 of us, and I've been here at Wake Forest for 14 years, and where hats in my work here, mostly doing clinical pediatric surgery, which is sort of the whole range of pediatric surgery. But one of the hats that I get to wear is to be the trauma medical director for the Pediatric Trauma Center. And so that allows me to be part of pulling people together at a place like this that has the resources and specialists and commitment to take care of children with severe and life-threatening injuries. And so as we talk today about safety and injuries and being at home and what to watch out for, it's definitely near and dear to my heart. We have a great team in pediatric trauma here. One of the people on our team is Luli Beckles, who her full-time commitment is to pediatric safety and injury prevention. So she's a dynamo and a real blessing to all of us that work with her. But she helps keep injury prevention for children at the forefront, both for us here at the Children's Hospital and also in the community, even more importantly.
Sure. Yeah, Luli, she is a great resource that Brenner Children's has as the pediatric injury prevention coordinator. We actually had her on one of the Best Health podcast episode a while back, talking about water safety, especially during the warmer months. So she's been a guest of ours before and provided some great resources about kids staying safe and while they're out swimming. So thank you and thank Luli for what you all do every day. Speaking of every day, a lot of people, their schedule has maybe been altered, either working remotely or possibly not being able to work at this time and having to do, help out with the kids at home with virtual learning. So what does your day today look like at Brenner Children's lately? How has this affected you?
Yeah, so some things are significantly different. We've had to cut back on elective operations or non-time sensitive operations, maybe is a better way to say it. Things that
Mm-hmm.
need to be done but can wait to be done.
Mm-hmm.
And trying to limit the use of the operating room for things like emergencies in that. Our clinics have been slowed down for some of those same types of diagnoses. But we are open for business, and we're committed to all manner of illnesses and injuries and problems that children and adults will see. So I think there's a lot in sort of media and just the spirit of the times of hunkering down and all that, and certainly in the media you get images from hospitals around the country and around the world that are overrun and sort of out-resourced. But we're here and we're ready to go, and we haven't said no to anyone for anything. We're just on a slow down for things that can wait, but we want to continue to reach out to those patients. We're doing virtual clinics to stay in touch and help troubleshoot and stuff. But things that need hands-on care, we can do it, and we can do it safely. We have the precautions in place, and so it's not like anybody would choose to come to the hospital that need to, even if there weren't a pandemic on. But but there's enough sort of anxiety and fear just sort of in the atmosphere that I think just to reassure people that we haven't lost sight of all the other things that a hospital exists for, and just sort of speaking for myself, we're definitely keeping our eye on the ball for pediatric injury, trauma, surgical things too. So we're good for that.
That's great information, and just a good reminder for people to realize or be reassured about. Obviously we don't like to see any kids have to come to the Brenner ED, but they do every day, and y'all are there no matter what kind of illness or traumatic injury might be. Y'all have full capabilities to take care of those kids and help get them better, correct?
Yeah, and we've changed a few of our sort of procedures for how we do it. We're currently in a physically different space than we used to be, but the people are here, and that's what's most important. The stuff can move around, and we can put on extra masks or different masks or that sort of thing too. But it's great to work with people who do trauma care because they're kind of quick thinking, solution oriented, can do, patient comes first kind of people. So I think that's just a great bunch that we get to work with here, and they're adapting to different things, but making adjustments in the middle of taking care of other things is sort of how we do business. So
sure,
it's a great team, and they'll do great.
Well, I appreciate that, Dr. Petty. One other question I did want to get into today was, schedules are different. Obviously, the children in this area, and many places across the country, frankly, they're adapting to virtual learning and learning from home, and completing their classwork at the house or someplace other than school, at least. So I know from speaking from personal experience, like the first week we had like a written out schedule and we were staying on task, but maybe that has changed a little bit over the last few weeks as we get further into this. So kids maybe have their schedules are more flexible. They maybe have more time to do things outside, do some exploring at home. With that being said, what are you seeing come through the Brenner Children's ED and through surgery over there as far as, are you seeing an uptick in any certain type of incident or injury that you can speak to today?
These months, April and May, are historically our busiest months of the year. Pediatric trauma does have this sort of seasonality. You can imagine that during the winter time, it's, sort of cold and wet and people are inside and all that. And then you get to, certainly summertime, people are outside, more kids are out of school. But it really is April and May that are our busiest month. And it's almost like you set your clock spring forward and here come the injuries. The weather changes, the days, you get more daylight and all that sort of thing. Spring break hits too. And I would say that trend has continued even in the last couple weeks. It's been we've been slow for things like hernia repairs, but we've been very busy with pediatric trauma and things that we see even when there's not a viral pandemic going on. So, the falls and the dirt bike injuries and the broken arms and, even motor vehicle traffic related sorts of things too. So it's a little too early to tell, from raw numbers how that's going to sort out. But my personal observation is we certainly haven't seen a slowdown of those things. And in a way, I think that's not a bad thing. I mean, you don't want to see injuries of any sort any time of year, but I think as we sort of are all recalibrating what does it mean to be at home for extended periods of time with sort of less space and more people and more stuff to do or to accomplish at home, as the kids are doing virtual learning and a lot of us are doing work things from home too. I think the fact that kids are being active is a good thing. I think I'm a father of 3 children, and I think as we've sort of, like you said, you sort of have a schedule in your mind, or how are we going to make this sustainable? It's not just spring break or a long weekend. I mean, this is weeks and weeks. And so for our family, we've just sort of put that out there as an sort of an expressed goal, is that every day, every one of us is sort of expected to do something active, to get outside, to get some exercise and all that we just can't be in our chairs on our screens, doing the things that we need to do all the time. And I think it's all right to sort of have that as a sort of a goal for the family. That it's not like a bell rings at school and it's time for recess and then we, come in and have our spelling or flashcards or whatever. So unless you sort of build it in or have some internal bell that rings, it's easy for one day to lead into the other and you haven't really done much to move your body. So part of that, involves some things that bring risk alongside them. So
I'm sorry, go ahead.
Oh, I was just going to use the example of riding a bike. Like, it's good exercise for kids. The weather is beautiful. The sun's out and the azaleas and the red buds are all popping and spring's here and all that. And I think there's a lot about being on a bike that's a good thing for children to do. But I think there's some risk with that, and you mitigate that risk with wearing a helmet and being in familiar places, having adult supervision or riding together with your kids, those sorts of things to sort of lower that risk, but not to sacrifice the exercise and the benefits that come from being active.
Well, you kind of just answered the next question I was going to ask, and I think that's great. It's, I love where you're going with this balance of, we can't all be hermits during this time of social distancing and being at home. We being active is an important part of helping our health. But I think you kind of just painted a picture that there's a responsible way of being active and doing activities such as riding your bike or playing sports. And then there's more kind of, I guess, irresponsible ways of doing those activities more carelessly and I guess with extra risk. We don't necessarily want kids trying to set a new jump in the air record with their bike to see how many feet up they can get, correct?
Yeah. Whether there's a viral pandemic or not, there are some things that are just a bad idea. So
what advice can you give to families to help keep kids safe during this time of us social distancing and spending more time together as a families and at the house? You've been on the front lines. You've seen kids come into the ED with various kinds of trauma, and it's not a great thing to have a kid come into the ED with serious trauma. So what can you do to help us families? I'm a dad of 2 boys myself. my youngest seems like he has no fear whatsoever.
Yeah.
Um, so what advice can you give us to help, keep the kids as safe as possible, but still maintaining, healthy activity?
Yeah. So, healthy is an interesting term in these times because a lot
Hmm.
of the things that we would traditionally reach for, like Little League or, let's put a group together and go play soccer, that sort of thing too, we're kind of trying to stay away from just as we think about smaller groups and physical distancing, that sort of thing too. So the new team in the sort of COVID-19 era is the family. And so
Yeah.
I think one route that you can go with that is to do things that are active together as a family. I mean, we are often home together, and if you can imagine this ridiculous scene as you drive around my cul-de-sac, I'm out there yesterday in the afternoon playing Foursquare with my kids, and I am not built for Foursquare like I may have been at one point, but
Yeah.
so, I mean, I think one overarching principle would be to kind of share in those activities with your kids to the extent that you can. I think to be involved with them, to lead by example. If you're going to be on the bikes, put your own helmet on too. Demonstrate to your children that this is something that's important and that you're responsible for your own brain in the way that you hope that they will be for theirs. So I do think we have opportunities to be active together with our children since there are more adults at home as well. I think certain things, again, this is sort of one of those, there's benefits to being active and exercise and getting sunlight and managing your mood and stuff that way, but to keep your head screwed on right. So you can imagine things like going out and kicking the ball around or throwing a baseball or a frisbee. You can keep distances. Everybody can wash their hands. You can be out in an open field. You can
Hmm.
burn off some calories. You can, have a good time with it. I think that sort of thing probably fits the bill for some of the physical distancing precautions that we should observe. I
Yeah.
think just being outside in nature and seeing trees and taking walks and, taking time to dig in the dirt or look at the flowers or, talk about those sorts of things. That's
Yeah.
perhaps not as calorie burning, but I think you're not connected to a screen when you're doing that sort of thing. You're sort of
Hmm.
seeing something in real life together.
Yeah.
So I think having space for your kids um, to be outside, to enjoy it. If you have access to a yard, I think parks are a little bit sort of harder, but
Hmm.
where can you find some open space or how can you do that? I wouldn't say any of these things are obvious, and they're certainly not being sort of
Hmm.
handed to us in the daily briefing about how you do that. But these are some of the things that I think we should think through because we don't know how long we're going to have to be some
Hmm.
level of restricted. And so we can't just be sort of bunker mentality inside plugged in, with the lights dim for the next few weeks.
Yeah, that's a great point, Dr. Petty, and appreciate you kind of talking to us a little bit about that. I think one thing I've noticed, and you can maybe speak to this, is if you notice it as well, is just, you know, we're running a little bit of a marathon here instead of a sprint with the new schedule of parents with kids, and the kids are running the same marathon. But I think for the parents, I've noticed, it's just we got to remember to kind of remain diligent and not let our guard down, which with by a certain time of the day, maybe you've done so many Zoom meetings or you've done enough virtual school tutorials that you're not quite as attentive maybe as you were first thing in the morning to kind of keep an eye on the kids. So that's pretty important to kind of monitor what they're doing all throughout the day, correct?
Yeah, I think everybody is connected to screens now in a way that if they were in physical school wouldn't be as much. And you know, for for your work and my work, we're doing video visits or whatever, and it's easy for that just to kind of slip into that's what you do
Hmm.
because there's always more to be done. I think that's part of the sort of cold hard truth of our electronic connectedness and things too. So I think it does sometimes take some real intentional decisions about how we're going to limit that. But it certainly, I think as parents become more involved with the day-to-day education that their kids are doing, it's fine to be kind of keep an eye open on, their screens and think about their time, and is this schoolwork time or is this sort of discretionary time? There's stuff out there, and that has to do well with all the reasons you want to be sort of aware of what your kids are seeing and getting into. But I think part of the time that we're living in, there's real uncertainty. I think we all carry around a little sack of worry with us that we weren't carrying around a couple months ago. And I think kids are doing that too. So, among the things that they have access to is news and images and stories and numbers and these sort of exponentially rising graphs and that sort of thing. So there's information that I think as parents and families, we have both the opportunity and the privilege of helping our children to manage that information in a way that's understandable and appropriate, and helps them to kind of put it into context, because you can get lost in that stuff, and there's uncertainty and there is worry, and it's not that it's imaginary, and none of us know sort of where those graphs are going to bend or curve or come down or how long. So we're all dealing with that, but I think it's all right to let your kids in on that to some extent. I think it's fine to be honest with them that, Dad's kind of worried about this. I don't know how long we're going to be at home, but isn't it good that we're together? I don't think you relinquish your sense of capacity or control in this. There are things that you can't control, but there are things that you can. And so being home, you can put it in that context of saying, look, we're doing this thing together. This is something that we're doing as a family, and we didn't design it this way, but by doing this, we're doing something safe, and we're doing something good for each other, and it's good for our neighbors, it's good for our town, and it's something that we're choosing to do and to go along with. And isn't that healthy? And aren't we sort of being part of the solution? So I think reframing some of that in a way that kids can understand, because they've got questions, and if you ask your kids, what have you heard about this, or what are you thinking about, or what are you afraid of, or what do you think the next few weeks are going to look like, or what are your friends telling you about, sort of inviting them to kind of let you into their sort of mental framework so that you can help calibrate that in a way that is honest, but realistic and reassuring. And it's part of what we do as parents anyway. We do that for, how do you cross a crosswalk on a 4-lane street, all right, here's how we do it. Yes, cars are dangerous, but look, they're stopped, and when this light looks like this, we go, and we're taking responsibility for this situation. We do that in other things, and I think for this time, it's very appropriate that we put that out there, that it's an appropriate topic for conversation from parent to child, but to be sure that we're doing that in a way that isn't overwhelming to them and isn't certainly graphic or sensational or worst case scenario, but isn't trying to hide it or be misleading either. And there's so many things in parenting that fall into that category. But this is now on our list as parents, and we didn't want it there, but here it is. And so it's one of the things that we get to help our children through, and they'll remember that. I mean, I think everyone knows that the times that we're in right now will be remembered for the rest of our lives. And there are things about how we conduct ourselves, how we treat people, how we care for our children now, that we also have the opportunity to really lead and care for them in a very special way right now, that they'll maybe tell their grandchildren about. Back in 2020 when we were sheltered in place, my dad told me this, or my mom did this for me, or this thing happened, and I'll never forget it. So it's not all risk. I think we have some chance to happy families together in this time that can create good things and important character and sort of life lessons.
Well, that's great info, Dr. Petty. I really love the mentality of kind of this, we're teamwork, we're in this together, and more of a macro, hey kids, let's look at the big picture here, and sure, we want them to be safe from acute injuries in the near term, but we can kind of reframe it a little bit and say not only can we be responsible and safe and not get hurt, but we can help set them up for maybe some long-term healthier ways of thinking or ability to pull through adversity in the long term, that is also helpful and healthy for our kids. So that's a great point, Dr. Petty. I appreciate that. I did want to circle back though. What is there, if there's one or two things that you see come into the ED, not necessarily now during a pandemic, but just like you said earlier, cyclical. If you're like, man, if I could change one thing as a pediatric doctor, and if kids would just stop doing this, that would be helpful. What's that one or two things where you're like, what, for the next little while, can we just really try and not do this as much? If here's your chance to broadcast it out on the airwaves.
Yeah. Well, do we have another hour? I mean, I'd love to sort of go on that. I think just a few things that maybe not. So, I mean, the number one would be seatbelts, right? Car seats that are appropriate size and properly installed, properly fitting, all that. I mean, we can't talk about child safety in this country in 2020 without saying that.
Yeah.
But people are not out and about as much or that kind of thing. That's not so much the spirit of the times, but it should be at the top of every list. So I would be remiss to say that. I would say one thing that we see often enough are scald burns related to being in the kitchen. And I think, I was thinking through about this, kids are not getting lunch at school. And so whether that's a brown bag of, peanut butter and jelly sandwich, or they're getting school lunch, kids are home and somebody's making that. And, we see things like the oodles of noodles, that's something that the instructions for preparation are pretty short. And so, older kids can manage that too. But it's the hot water in the microwave thing that's usually sort of above somebody that then spills out. Or the stovetop boiling water for making, pasta or noodles and noodles or that sort of thing. Turning the handles in for that, because it's the little people who can't get the adult vantage point view of what's going on in the stove that are at risk to have that then come down on their face, on their chest, that sort of thing. So we're continuing to see that. It would be premature to say that we're seeing more or less than that, but that is an injury that happens often enough, and it happens in that kind of way. There's a hot cup of coffee or soup or noodles or whatever up where somebody can just barely reach it, or they can't see, or they're getting it out of the microwave and it's way up there, or they have to get the step stool to get it out, and it just takes a second to have that happen. So I think as more lunches are being made at home and more kids are spending more time in the kitchen, I think that would be something that I would say, here's a great opportunity to sort of talk that through, think that through as a family. I think this time of year we're out in our yards more.
Yes.
And isn't that great? And in the spirit of being outside, and maybe you're planting a garden or you're doing something together with your kids, but I think the lawnmowers are humming, and managing lawnmower safety is something that this time of year we just see an uptick in that. And I expect that will be true. So, young children, my advice would be, really shouldn't be in the yard when the lawnmower is going.
Yes.
I mean, I think groups like the American Academy of Pediatrics would say, to do a push mower, a child should be 12 or older, and certainly a riding mower even older than that, maybe driver's license age, because there's a certain amount of sort of strength and coordination and insight, sort of impulse control that you need to sort of be responsible for that. And
yeah, sure, absolutely.
certainly a child should never ride on a mower with an adult. And part of that is the blades, they don't just sort of merely cut the grass. Anyone that has mowed the grass with a bag or with the bag off knows that there are sort of air velocity vectors that are generated by that, to where there is suction underneath the pan, and then it ejects from the top of that. So it doesn't take much of a child to get underneath that before more of the child comes underneath that. And unfortunately, we see those injuries too. And the smaller the child, you can imagine, the greater the destruction. So
Sure.
I think a word on lawnmower safety is timely for this time of year. Historically, it's sort of when we see these things, and certainly as people are out in the yards more and the kids are home more, and that becomes a place to do some of the things that we were talking about earlier, about being outside together and getting some sunshine and talking about nature and getting away from the screens and being together. I mean, all of those sorts of things too. But I think the lawnmower becomes a hard stop in what family time in the yard looks like. So those would be a couple things that I would sort of put out as kind of timely, given the situation with coronavirus and being at home. I mean, I think I talked about bike safety. I'm a big believer in being on the bike, and that's such a healthy thing to do, but there's sort of safety stuff that we need to be mindful of. But kids who show up here with bike injuries, I usually try to encourage them to not give up biking completely, but just sort of think that through.
Yeah. Well, with Luli, our pediatric injury prevention coordinator, she would get after both of us if that wasn't brought up more than once. So we can't say that enough. Just helmets. But Luli would also say it's very important to have a properly fitted helmet. I've heard her say that many times. So not just throwing any helmet on, but make sure it fits correctly, or else it could provide some issues.
Yeah, and I would just sort of elaborate on that a little bit. Helmets are part of bike safety, but certainly where you're riding your bike, who you're riding it with, what the sort of context is relative to traffic and terrain, and kind of like you said, the world's highest high jump. There's some insight stuff there, some risk-taking stuff there too, that all has to be brought to bear. And I think if you could inject a little bit more of something into that, it would be sort of adults being part of it or supervising. I think that just keeps a layer of sanity on that, of leading by example and being together too. So bike helmets are certainly indispensable, but they don't make you invincible on a bike.
Yes.
And I think those other things just need to also be emphasized as well.
Yes. Well, I'll say, I guess I'll say I'm fortunate, just given some of the risks I took when I was younger. I've only lost consciousness twice in my life. Once as a child, once as an adult. And the one child incident was I was on a bike and I was doing something very stupid and shouldn't have been. I was in that mindset of seeing how high we can jump and competing with the neighbor kids, and took a bit of a spill. So I still remember that all these years later. So I can attest to trying to use common sense when you're on a bicycle as well.
Right.
Well, Dr. Petty, thank you for joining us today. We're getting ready to wrap up, and Dr. Petty's been talking to us about just a reminder, to everyone out there who's caring for a child, a guardian, a parent, a family member, a relative, just to be diligent and to utilize the common sense and to take appropriate measures, while still, having a balance of wanting the family to be active and healthy and outdoors, but doing so in a safe way that can, hopefully prevent a trip to the Brenner ED. I did want to just remind people, there are definitely plenty of resources about what Dr. Petty has talked about, some of what he's talked about today on the Brenner Children's website, and that's brennerchildrens.org, brennerchildrens.org. And people can read up on additional resources there, and should you need to see a doctor through Brenner's, that is available as well to look up on that website. So Dr. Petty, thank you so much for joining us. I know you're busy, you got to get back to doing the rounds, but this has been really great information, and I hope you come back and join us on the Best Health podcast at some point in the future too.
Oh, anytime. It's been my pleasure.
Well, thank you so much, sir. To everyone listening to the podcast today, we appreciate you taking the time to listen and helping keep all our kids safe and healthy and happy. And until we get back together next time, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.